Hello, my name is Matthew Gray, and I'm going to introduce to you today the UT1 Health Initiative Seed Grant Project, Socioeconomic Epidemiology of Disease Risk in Wildlife Trade Networks. Our project is focused on the very large issue of global wildlife trade and the translocation of emerging infectious diseases. And wildlife trade is a huge industry. It's a $300 billion global industry involving 2.5 million animals per year, around 1,000 different species in 180 different nations. And in the United States, there are currently no policies or regulations to support the clean trade of wildlife, unlike agricultural animals that require animal health certificates, which really opens the floodgates for novel pathogens to enter the United States and impact those industries, but also that has the potential of spillover to wild systems and negatively impacting biodiversity. So the particular wildlife trade industry that we're interested in for this project is the amphibian trade industry, which the United States comprises 50% of the global market. And we're especially concerned with three emerging pathogens: two chytrid fungi, BD and B. sal, and ranaviruses, which have collectively contributed to over 500 species declines, over 90 species extinctions just in the last 40 years. And so the amphibian trade network is similar to various other wildlife trade networks where animals can enter through legal and illegal pathways. And once they enter the network, there are distributors, there are hobbyist breeders, commercial breeders, various retailers of different sizes, and ultimately those animals end up in the hands of consumers, and both consumers and the industry themselves have some probability of spillover to the wild ecosystems, either through releasing unwanted animals or potentially disposing of contaminated aquaria contents in the environment. And what we're particularly interested in from a research standpoint is trying to understand what factors within these facilities, okay, result in pathogen magnification within a node. So what are the different biosecurity and husbandry practices that ultimately line up to actually increase pathogen prevalence, which then could result in pathogen amplification through the whole network. And what's particularly interesting from a science standpoint that hasn't been investigated previously is that, those disease dynamics are driven by socioeconomic decisions of the industry and consumer demand. So we have this really interesting dynamic of humans driving the disease dynamics within this particular network. And so for this particular project, we are just collecting preliminary information, but we would like to estimate the pathogen prevalence in international shipments and domestic trade, identify what factors industry knows help contribute to pathogen amplification, what factors are driven by socioeconomic feedbacks of industry and consumers, or how are those factors driven by those socioeconomic feedbacks. What's the willingness of industry or consumers to implement strategies to reduce disease risk? And what's the non-market value of amphibians as perceived by the public? These are our objectives that are outlined within our proposal. And just this, again, is a preliminary project that is really part of trying to collect some initial information on a larger project that we've proposed to the National Science Foundation, which is currently under review. If you have any questions or would like more information, please don't hesitate to reach out to me or Neelam Poudyal or Nina Fefferman at the University of Tennessee. You can also find out more information on the UT1 Health Initiative website and the UT Amphibian Disease Laboratory website. Thank you very much.